Well, we turn our focus now to mental health. Suicide is a serious public concern in South Africa, with official statistics suggesting that the prevalence of suicide is 14 per 100,000. The South African Stress and Health Study estimated lifetime prevalence of suicidal ideation, suicidal plans, and attempts at 9.1%. 3.8% and 2.9% respectively. Well, to speak to us in terms of how people who are struggling with their mental wellness can be supported is clinical psychologist Themba Manzini. Mr. Manzini, good evening to you and thank you so much for your time. So certainly when we look at those numbers, not just in terms of suicide, but just the general mental well-being of South Africans, the figures point to a country that is becoming more aware but not completely able to offer full support to those in need.
Good evening. Thanks very much. And thanks for sharing those statistics. Indeed, I do understand the concern that there could be more awareness, but sometimes with awareness, at the end, we want to see the action, we want to see the implementation. So it does show that there is a gap between the awareness and the implementation of what people are aware of or what they know. So we need to move or strongly move towards that so that we can be able to see a difference and be able to see many lives saved.
What remain some of the biggest challenges to those who are struggling with various issues being able to access help or the support they need?
I think part of your answer is in the word that you have just mentioned, struggling to access. So there are those who do want to get help, but they don't know where to go to. They struggle to get access. So the issue of access is still a bit limited. And we can even mention or think of people in rural areas where they even struggle to see a psychologist or a psychiatrist. So then that becomes a challenge. And then access can also be limited nowadays in terms of confidentiality, where people might be a bit concerned, or maybe people, they go to social media and vent out, and sometimes they do not get the right help or advice, or maybe seek their own help through online means, but that is not sufficient sometimes. So people do need to get proper help. So those are some of the challenges, and the stigma around mental illness, it's still hanging in there, where people are not free enough to be able to voice out without being judged or without being stigmatized, and so that they can be able to get the necessary help that they want.
I think one of the biggest things to remember is the fact that yes, we might have, very relaxed lockdown restrictions currently, but we're still very much in the grips of the impact that COVID-19 has had on the lives of many people, and that includes their mental wellness as well.
Yes, indeed. Without any doubt, yes, the impact of COVID-19 is still with us and might even be with us, especially on the mental health and well-being of people, even shortly after maybe the virus has been stabilized. So those are some of the hidden factors that are there. And we also need to remember that even before COVID-19, there were people who were under duress, there were people who were stressed, people who were depressed. We always had these things, and then COVID-19 came, it made things worse for many people. Many people have lost jobs. Many people are struggling to find their feet. Many people are, even though now it's relaxed levels of the lockdown, but there's still a lot of adjustment that is happening. So this transition becomes essential for people, especially with their mental health. So they need to be able to go through this transition, to be able to adapt and adjust. If people are going to be able to adapt and adjust well, then it will promote more their mental health than to leave them vulnerable.
Let's talk specifically about people who are having suicidal thoughts. What is the best way to support such an individual?
The best way to support people who have suicidal thoughts, we need to listen to them. And then by listening to them, it's taking seriously whatever they share with us or the thoughts that they share with us. So we should never take them lightly. And by listening to them, we also need to look at their non-verbal or body communication. Some of them might not verbalize that they want to kill themselves, but we know that with people who are depressed, we'll see the body language. They lack interest, low mood, they seem to be tired most of the time. Their affect is very much sad. So we need to also take note of that and then start to talk with them. Once we understand that, we should not be quick to judge them. We should not be quick to want to come with solution. We need to try to understand how come is it that they want to commit suicide or they think of that. Because most of the time we are quick to give solutions and we don't give them the proper listening, as I've just mentioned.
Themba Manzini, let's leave it there for tonight. Thank you for your time, and he is a clinical psychologist.